Good afternoon. My name is Stella, and this webinar offers closed captioning. To enable closed captioning, click on the live transcript button on the bottom of your screen and choose your preferred method. Welcome to the City of Chicago Department of Business Affairs Consumer Protection webinar. Please note, any website or email that I mentioned will be posted in the chat. For those seeking business license assistance, please visit the Small Business Center here at City Hall or call 312-74-GO-BIZ. Also, business license can be applied for or renewed online at chicagobusinessdirect.org. If you are a part of the BACP Entrepreneur Certificate Program, you can get credit for joining this webinar by sending an email to bacpoutreach@cityofchicago.org. To learn more about this program, please visit chicago.gov/business education. Also, this webinar is being recorded and will be available at youtube.com/Chicago BACP. We encourage all attendees to ask questions. Please use the chat box and send your questions. There will be a Q&A session at the end of this presentation. Please note that the views, information, and opinions expressed during this webinar are solely those of the presenter and does not necessarily represent the official policies or position of the Department of Business Affairs and Consumer Protection. Today's webinar is entitled Chicago COVID-19 Updates. At this time, I will now turn this webinar over to Jennifer for us to begin.
Great. Thank you so much and good afternoon, everyone. I hope you've all been well. I am Jennifer Sy. I'm the Chief Medical Officer here at the Chicago Department of Public Health, and it's my pleasure to give you some COVID-19 updates today. So just to go over what I will be reviewing with all of you, I'll give you an overview of our COVID-19 data. I'll go over where we're at in terms of our COVID-19 community level and explain a little bit more about what that means, discuss current guidance, including for testing, vaccines, and boosters, and also go over therapeutics that are now available for COVID. So this is our dashboard. I'm hoping that all of you are now familiar with it. Again, you can see this every day at your convenience if you go to chi.gov/COVID-. But here we're showing our cases, hospitalizations, deaths, and positivity, including tests performed and vaccinations administered. But I'll point out a few data points for you. So our cases, we have over the last several weeks seen a rise in our cases. As you can see, we're over 1,000 cases per day on average. We're starting to see some early signs that we may be plateauing, but it's too early to tell. But the important thing to note again is that the cases remain very high in our city. When you look at our hospitalizations, you'll see that we have had an increase in our hospitalizations over the last few weeks. And I'll tell you a little bit more about the hospitalizations, but I want to point out that thankfully, our deaths have remained low. We're averaging less than 1 death a day, which is a good thing. You can see that the current daily average is 0.29. So again, indicating that more days than not, we're not seeing deaths. We want that number to be 0 and stay 0. So that's why we are continuing to have this conversation to make sure that all Chicagoans are staying protected. But again, going to the hospitalizations, while there has been a rise, it's been a very slow rise, especially when you look at what happened last fall and winter during the Omicron surge. So again, something that we are watching very closely as our cases have been high. And you will see that there is a lag in hospitalizations oftentimes behind when the cases increase. But again, our hospitalizations have increased, but at a very slow rate. Our hospital capacity here in Chicago remains good, and we want it to stay that way. So one important way that we can make sure that hospitalizations and deaths are minimized, as you all know by now, vaccines. We need to make sure that all Chicagoans who are eligible for the vaccine are getting vaccinated. And if they're eligible to get boosted, that they're also getting the boosters. And I'll talk a little bit more about the booster guidance in a moment. But this graph here is showing the difference in those who were boosted, fully vaccinated. So meaning having completed that primary series. So the 2 Pfizer and Moderna vaccines or the 1 Johnson & Johnson, compared to those who were unvaccinated. This is showing hospitalizations, and the peak, of course, is during our Omicron surge this past winter. You can see the stark difference in the rate of hospitalizations among those who are unvaccinated versus those who had been vaccinated, and in particular, those who were boosted. you'll see the same trends again for deaths. Again, boosters provide significant protection against severe illness, hospitalization, and death, which is why we are really, really wanting all of our Chicagoans who are eligible for a booster to make sure that they get that booster. So I'm going to talk now about our COVID risk level. So what is the COVID risk level? As many of you may know, the CDC came out with a new way of framing how a community can know the impact of COVID-19 in their community and the risk of the hospital system being stressed. So currently, under those metrics, which take into account not only new cases, but really focus on that hospital capacity, because we want to make sure that our healthcare providers are available to treat anyone who needs their help, whether it's from COVID or not. So new cases, new COVID-19 admissions per day, new hospital admissions, that is, and then the proportion of staffed inpatient beds occupied by COVID-19 patients. So when you look at all of those measures, there are certain thresholds that will take you from low, medium, and high. And currently, Chicago is at a medium level. This data is available on our website as well. If you go to chicago.gov/COVID or chicago.gov/coronavirus, however you want to enter it, it'll take you to our COVID response page. You can follow along where we are in terms of our risk level and the metrics that we use to figure out which level we're at. So again, currently we're at medium. Again, the different levels tell us the impact on the healthcare system and what level of severe illness there is out there in our community. Currently, masks are strongly recommended, but part of the reason why we're here today talking with all of you is because we anticipate that with the update later today, so the CDC updates their tracker every week, that Cook County will move to a high level. And that means Chicago will also move to a high COVID-19 community level. And that means more mitigation measures, more prevention, more thought to what we're doing as we're engaging with each other is going to be needed and absolutely critical. So this is showing our guidance based on the levels that we're at. So again, currently we're at a medium level. And so we have been recommending that individuals wear a face mask when you're in an indoor public setting, and doing all of the other COVID preventive measures that we have been talking about over the last more than 2 years now, right? Staying up to date on your vaccinations, getting tested if you're symptomatic. But again, we anticipate that we're going to be moving into that high COVID-19 community level this week, which means there's going to be a stronger emphasis. We really want all Chicagoans to wear a mask indoors when you're in public. Consider avoiding higher risk activities like crowded indoor gatherings and limiting gatherings to small numbers, in addition to doing all of the other things that you've been doing to keep yourself protected. One thing that I will note is that the CDC tracker, again, it's by county. So we are under Cook County. For the cases, they're looking at Chicago, including suburban Cook County. But when they're looking at the hospital data, and this is where it can get a little bit complicated, which is why I'm explaining it to you now, the hospital data is actually based not only on Cook County, but it's what is called our health service area. This is the way CDC tracks hospital data in general, whether it's related to COVID or not. And that includes many counties, including Cook. So not only Cook County, it includes McHenry County, Lake County, DuPage County. And we know that hospitalizations in our sister collar counties have been going up at a faster rate than here in the city of Chicago. So just something to keep in mind. In terms of major mitigation changes, like bringing back a citywide indoor mask mandate through a health order, those we are only going to pull out based on our city of Chicago's hospital burden, rather than, again, what I just explained, that federally defined health service area, which the CDC is looking at when they determine the community level of COVID in Cook County. So while we anticipate that we are going to be moving into that high COVID-19 community level this week, There will not be a citywide indoor mask mandate until we see that our City of Chicago hospitals are being burdened, that there are many new daily hospital admissions related to COVID-19, or the proportion of inpatient beds that are being occupied by COVID-19 patient. If that number is rising and our hospitals are being burdened, this is a warning sign to us. It's a warning sign that we need to put out more measures to protect each other and to protect our hospital system. But until that happens, again, very strong recommendation to protect yourself, for your patrons to protect themselves, for your staff to protect themselves by wearing a mask indoors when you're in public. But again, not a health order at this time. As a reminder, there are certain settings where masks are continued to be required, and those are healthcare settings and congregate settings like nursing homes, shelters, and correctional facilities. So settings that we know are higher risk in general, or have individuals who are at higher risk of severe outcomes attending those areas. And then as a reminder, nothing has changed in terms of our guidance for those who have COVID, who have symptoms, or have been exposed to someone. Those individuals need to continue to wear a mask. So nothing has changed there. But again, anticipating that Cook County will be moving to high community level on the CDC tracker, which means we need to be even more vigilant. We need to make sure we're wearing our masks indoors. We need to continue doing all of the other measures we've been doing, testing when we're symptomatic, making sure we're staying up to date on our vaccines and our boosters. Other important information for all of you is that the following remain unchanged for businesses. So we're not putting out capacity restrictions like we did earlier in the pandemic, no social distancing requirements. While we do encourage individuals to think about spacing when they're out and about, in terms of for businesses, we're not requiring that you space your tables apart a certain distance. Again, we're at a different place in the pandemic right now, and there are no limits on your hours of operation. So nothing has changed there. As a reminder, we have signage that you can use to help prompt and remind your patrons about wearing a mask indoors. You can go to our website, again, chicago.gov/COVID. And if you click on the communication resources area, you'll find different signs that you can download, print, and post in your businesses. Again, to remind your patrons and your staff about all of the safety measures that they can take, including wearing masks indoors. So just wanted to touch on other guidance just as a review for all of you, so that you can help communicate this out to your patrons and to your staff to keep everyone safe as they frequent your businesses. So who should get tested? Again, nothing has changed here. Anyone who has symptoms of COVID-19, regardless of whether you are vaccinated, whether you've been boosted, if you have symptoms of COVID-19, you need to get tested for COVID-19, because the only way to know for sure whether you have it or not is to get that test. If you have been exposed to someone with COVID-19, so you came into close contact, you should get tested, again, regardless of your vaccination status. And the recommendation is to test at least 5 days after contact. If you're not up to date on your vaccine, meaning if you are eligible for a booster, but you haven't been boosted, or you are you're just unvaccinated and you're participating in a high-risk activity, like a large, very crowded gathering, we recommend that you consider testing yourself afterwards to make sure that you don't have COVID-19, because you could have been exposed, especially as our case rates are increasing in the city. Again, before and after travel, there are testing recommendations there. Make sure to go to our Chicago Travel Advisory website for that, to get the most up-to-date information on when and who should be testing. And then again, as our cases are going up, consider getting tested if you're planning to participate in a large or crowded indoor gathering. Again, a way to keep yourself and others safe. As a reminder, the federal government has been doing another round of free home tests. Any individual can go to covidtest.gov and put in that order to receive those in the mail. So another great resource to remind your staff and for patrons that you are in communication with, just remind them that these free home tests are available. Vaccination, again, the number one way to protect yourself and others around you from COVID-19. Vaccines are available for everyone 5 years and older. We are eagerly awaiting a vaccine for our Chicagoans who are under 5 years of age. We know that the FDA is going to be meeting on June 15th to discuss the data around the Moderna and the Pfizer vaccines. So stay tuned, but we anticipate having a vaccine available for our younger Chicagoans sometime, hopefully at the end of June or early July. But for right now, it's everyone 5 years and older. And it's important to note that recently, actually, boosters were recommended and authorized for 5 years and older as well. So just some reminders about definitions. So being up to date on your COVID-19 vaccinations. That means not only have you received all doses in the primary series, so what we are previously calling fully vaccinated, right? So having received 2 doses of the Moderna or Pfizer vaccine, 1 dose of J&J. So you've received all doses in the primary series, and when you're eligible for a booster, you have received that booster. Then you are considered up to date. As a caveat, if anyone is moderately or severely immunocompromised, there are slightly different recommendations, but this is for the general public. In terms of your first booster, that should be received 5 months after completion of that primary series. If you happen to have received the J&J vaccine, you should get a booster 2 months after having received the J&J, and you should be boosted with an mRNA vaccine, meaning either the Moderna or the Pfizer vaccines. This is for everyone 5 years and older. And I will just make a note that the recommendation right now is that individuals should be receiving either the Moderna or the Pfizer vaccines, the mRNA vaccines. The Johnson & Johnson should only be used for those who cannot receive the Moderna or Pfizer due to an allergy or another reason, or for some reason have a very strong preference for the Johnson & Johnson. But from a clinical standpoint, from the CDC, from the FDA, the recommendation is that individuals should be receiving either Moderna or Pfizer unless they can't because of an allergy. In terms of second boosters, there are some individuals where we recommend a second booster because they are at higher risk of having those severe outcomes, so being hospitalized or potentially dying from COVID-19. So those are adults 50 years and older, and people ages 12 years and older who are moderately or severely immunocompromised. This second booster is due 4 months after the first booster. But again, as I showed earlier in this webinar, being boosted significantly increased Chicagoans' protection against hospitalizations and deaths. And we particularly saw this during that Omicron surge. Vaccines have been around for more than a year now. We know they are safe. They have been effective, again, as you can see from the hospitalization and the death data from Chicago. And so we really want to make sure all Chicagoans are not only getting that primary series, but also getting boosted when you're eligible. The good news, again, we're at a different place in the pandemic. Vaccines are widely available. And as a reminder, there are many different places where Chicagoans can get vaccines: pharmacies, healthcare providers. We are continuing to provide our Protect Chicago at Home service. You can see the website there. You can also call us to set up an appointment for someone to come to your home to give you a vaccine or a booster. The city of Chicago, we also have our health department immunization clinics. Chicago Public Schools are providing vaccines for the CPS community, and there are also community events that are going on. So to find a vaccine, lots of resources. Vaccines.gov is a great place to search by zip code, a location close by to you. And again, our city's COVID-19 helpline is always available. You can give us a call at 312-746-4835. We are eager to help our Chicagoans access these very, very important vaccines and their boosters. And then finally, I just wanted to touch on therapeutics. Again, we are at a different place in this pandemic. It's certainly not 2020, and it's not 2021 either. We are in 2022. Not only do we have our masks, good testing resources, widely available vaccines, including the boosters, but we now also have treatment for COVID-19. And these treatments can really reduce your risk of hospitalization and death. So these treatments are specifically for individuals who are at higher risk of severe outcomes. So anyone 65 years and older automatically eligible for a therapeutic. And then if an individual has underlying conditions that put them at higher risk, they are also eligible for a therapeutic. And these underlying conditions are actually pretty broad. They include being overweight and obese. They include even being a former smoker, individuals with disabilities. So what we are encouraging is that for all Chicagoans to reach out to a healthcare provider if you test positive. And this can be on a home test. If you test positive on a home test, that is a good test. Reach out to a healthcare provider. There are two versions of these treatments. There are medications that you can take by mouth. So you just get a prescription like any other medication. You can take it at home. You have to take these within 5 days of symptoms starting. And so we have heard some Chicagoans saying, I don't feel that sick. The whole purpose is to prevent you from getting sicker. So please, it doesn't matter how mild your symptoms are. Call your healthcare provider, find a healthcare provider to get a prescription for a treatment. There are also IV medications. You may have heard about monoclonal antibodies or an antiviral medication called remdesivir or Veklury. You can take these within 7 days of symptom onset. So there's a little bit of a longer time frame. But again, this requires a healthcare provider's referral. So the difference between these treatments from vaccines, you can't just walk into a pharmacy and just get it from a pharmacist. You do need a prescription or a referral. There are many pharmacies around the city that have clinics within their pharmacies. So it's someone who can actually evaluate you to see if you're eligible, because a provider does need to go through your medical history, go through your medications to make sure there aren't any interactions. But these are effective treatments, another way to prevent our hospital system from getting burdened, and more importantly, to prevent our Chicagoans from getting very sick or from dying. So a couple of resources that I've listed here. There's a nice pharmacy locator from the federal government where you can find pharmacies that have the oral medications, and also pharmacies and clinics that are doing what's called test to treat, meaning you could get tested, evaluated, and receive a prescription and receive the medication in one visit. And again, if you have any questions at all, we are here at CDPH. We are ready to help you. You can give us a call, 312-746-4835. Our call center can help locate a pharmacy or provider that can help you access these therapeutics. And we also have a website dedicated just with more information on those therapeutics. So again, I thank you for all that you have been doing to keep your staff, our Chicagoans safe. We are seeing a rise in cases, and we have seen a rise in cases. And so we do, again, anticipate that Cook County will be moving to that high level of community level of COVID-19, which just means we need to be more vigilant. We really want all Chicagoans to be wearing your masks when you're indoors in public. Don't forget about the various resources that we have. Please get vaccinated. Please get boosted if you're eligible. Don't forget about the therapeutics that are available. And again, thank you so much. And I am happy to take any questions that you all may have.
Jennifer, I see a question. Given all of this information, will the city be bringing back the mask mandate?
Yes, great question. I know that's top of mind. So again, we're moving into that high COVID-19 community level. And our recommendation and the CDC's recommendation is that everyone should be wearing a mask indoors in public. However, here in the city of Chicago, we are going to be looking at our hospital capacity data and the stress on our hospital system. And until we see that our hospital system itself is burdened, we will not be issuing a health order mandating masks indoors in public. So while Cook County as a whole will be moving into that high COVID-19 community level, we've been watching, as we have throughout the pandemic, very closely our own hospital capacity and our hospital numbers. We are at an okay place right now, as you saw earlier. And so at this time, we will not be issuing a health order requiring masks indoors in public. However, if we see that our hospital admission numbers are going up, or that the number of beds being occupied by COVID patients are going up, and concerning and really stressing out our healthcare system, at that time, we may issue a health order, again, to protect all of us and to protect our health system.
Does the government still provide free at-home tests?
Yes. So again, it's that federal government website, covidtest.gov. Go ahead. They announced a couple of weeks ago or so that they were doing another round of free tests. So you can do that. The other thing to keep in mind is most insurers should be covering those home tests as well. So if you need to get a home test from a pharmacy, you can get it at no cost through your insurance benefits as well. But that federal site is a good site to get those at-home tests mailed to you. And then the other thing to keep in mind is there continue to be testing sites around the city. Some of them are supported by the federal testing program, where you can get, again, a test at no cost. So lots of resources out there. But yes, thanks for bringing that up and highlighting that again. Those at-home tests, very good resource and a really great way to very quickly know whether you have COVID, whether you're contagious. So I encourage everyone, if you haven't already ordered your most recent round of at-home tests, to go ahead and do that from the federal government.
Can you repeat how you know and when will there be a high transmission rate? What percentage of transmission is considered high?
Right. So in terms of case, so we're not just looking at case numbers. It's those CDC metrics. So we've already exceeded their threshold of 200 cases per 100,000 of our population over the last 7 days. So we're already there, which automatically puts you at medium level, regardless of where your hospitalizations are. The next number to look at is those hospitalizations. And I will just remind again, if you go to our website, chicago.gov/COVID, right there, it'll tell you the community level. There is a link that you can click on and it actually tells you the numbers. But in terms of our hospitalizations, it's the number of new hospital admissions. And it's a little bit tricky because it's 10 per 100,000. And if you exceed 10 per 100,000 over the last week, then you would enter into a high level. And then if more than 10% of your beds are being occupied by COVID-19 patients, then you'll enter into that high level too. We're not quite there yet for the city of Chicago, but as a reminder, the CDC, for Cook County, the CDC tracker, they're looking at our health service area, which includes other counties beyond Cook County. But the thing is, it's not like we have walls between our borders. People are moving around. This is a sign to us when we move into that high level that, hey, we need to be doing some extra precautions here. But in terms of pulling out stricter measures like a health order, we're going to be looking at our Chicago data. So again, new hospital admissions, percent of hospital beds occupied by COVID-19 patients. You can follow along those numbers again on our website, chicago.gov/COVID.
What is the percentage of people who have been boosted in Chicago?
Yeah, so this is a number that we're working on. Unfortunately, only about 40% of eligible Chicagoans, this is for 12 and up, because those 5 and ups, they were only recently authorized to get that booster, but only 40% of 12 and up have received a booster. So we have a lot of work to do. Boosters, vaccination and boosters for sure. We've heard that it's leading to pretty mild infections if someone happens to get COVID after being vaccinated or boosted, but more importantly, it very significantly reduces one's risk of being hospitalized or dying. So we do have some work to do on those boosters, widely available across the city. And again, you can always reach out to us if you're having any difficulty finding a booster, but we really, really encourage everyone who is eligible to go ahead and get that booster, especially as our cases are rising, so that we can make sure you are not getting hospitalized and our hospital system is preserved. And so we don't have to do any stricter mitigation measures here. We really want to have a nice summer. And of course, we want to make sure we continue to move out of this pandemic.
Can you speak on long COVID?
Yeah, that's another important thing to bring up. So long COVID or post-COVID syndrome, it's something that we are starting to learn more and more about. There are many unknowns, but we do know that this is a potential long-term effect after one has been infected with COVID. The symptoms can vary, but people can feel very fatigued, tired, kind of brain fog, having trouble breathing for several weeks to months after having been infected. So more data to come. Another good reason to do whatever you can to prevent yourself from getting COVID, because certainly, again, we don't want anyone to be hospitalized or to die, but because there is a potential to get this post-COVID syndrome, preventing infection is important as well. There is some early data that suggests that if you're vaccinated, that there may be less likelihood of getting post-COVID syndrome or long COVID, but again, many unknowns, but we're really grateful that many researchers are looking into this question, including right here in Chicago. So more information to come, but a very important thing to keep in mind, and another really, really good reason to do everything that we all can to protect ourselves from getting COVID.
Said you may be seeing early signs of decline in numbers. If that happens, then would we move back to MED?
I'm sorry, what was that last part? That we would move back to
MED?
Oh, medium. I'm assuming medium.
Okay, that's all I said.
Yes, yeah, no, that's thank you. That's a great question. So yeah, we would have to, well, for the community level, the hospitalizations would have to go down as well. In terms of the cases, maybe I'll address, to get to low, we'd have to get to less than 200 cases per 100,000 of our population over the past week. So that is somewhere like high 700s. We need to get below that, and our hospitalizations have to stay low in order for us to go to low. But the question is right on. So as long as we can go, our cases go down, hospitalizations go down, then we will move back down to the lower level. So again, you can follow this and learn more about the metrics if you go to our website. But we, trying to be optimistic. We know that the weather has warmed up, more people are moving outside. At the same time, we know that this is a typical season for graduations and other parties. So while we are happy to see that maybe we've started to plateau, again, too early to say, and we really are closely following our hospitalizations, but more the reason, like for right now, just do what you can to protect yourself, to protect others from COVID, put that mask on when you're indoors, get vaccinated and boosted so that we can move out of this danger zone and we can have a nice, calm, enjoyable summer. But yes, great question. It's the CDC community levels are really nice. It's nice that we have a nationwide metric so we can follow along as you're traveling to other areas too. So highly recommend it. Again, you can get more information on our website, and the CDC does have their tracker that they update every week. Thursday evenings is when they usually do their updates. And so you can, before traveling, you can even go on and check to see, oh, I'm going to this county in another state. I wonder what their level is. So you can know what your level of risk may be as you go.
Okay, Many of my staff are vaccinated and received their first booster. There seems to be some hesitancy towards the second booster because there is a belief that better vaccines are on the way. Is this true?
That's a great question. First of all, I'm really glad that your staff all got their first boosters. And if they're eligible for that second one, again, I will say, especially during a time when we're seeing a rise in cases, get that protection now. Get that protection now. The CDC, when they put out their recommendation for the 5 years and older to get boosted, they strengthened their recommendation for that second booster for individuals who are 50 years and older, or those who are 12 years old and older and are moderately or severely immunocompromised. So go ahead and get that booster now, because you want to get protected now, especially as we are anticipating Cook County moving into that high community level of COVID-19. There have been discussions about whether in the fall we may have new versions of the vaccine or the boosters that are more targeted to newer variants of COVID. But again, those are discussions that are still being had. People are still studying it, trying to develop those vaccines. But the important thing is to get protected now. So if you're eligible for that second booster, please go ahead and get it. The reason you're eligible for the second booster is because you are at higher risk of those severe outcomes from COVID, hospitalizations and deaths, and we don't want you to get that ill. So go ahead and get that booster. And if there is another vaccine that folks have to get in the fall, the CDC, the FDA, and others will make sure that they have appropriate recommendations around those who have received all of their current boosters. So don't wait. Get that booster now is our recommendation.
Can you clarify which employers need to report positive cases at their location?
Right. So anytime, if you're a business and you have, if you have to pause your operations because you have so many cases of COVID, or you have 5 or more cases within the last 14 days, whether it's patrons or staff, you should be reporting that over to the health department. If you are ever unsure of anything, or if you have any questions, you can also contact us. So we have a specific team dedicated to workplaces. So if you are a business and you're not sure what to do with regards to a COVID case, please contact us. But in terms of, so all businesses in the city of Chicago are required to report, again, anytime you have 5 or more cases of COVID-19 within the last 14 days, or if you had to pause business operations in any way because you had so many COVID cases, regardless of the number, you have to report that over to us. And it's so that we can help you and guide you and make sure that your staff and patrons are staying safe, and that we can help support preventing further outbreaks in the future.
Got some comments saying this has been fantastic. Thanks for the information. Thanks for sharing your knowledge. How does this impact schools?
That's another great question. So, we really want to make sure that everyone's able to learn safely. That is like the job of all individuals, our young Chicagoans, right? So in terms of the current guidelines, it's the same as for the community. We want everyone to wear a mask indoors. We don't have a health order mandating universal masking in schools from a legal standpoint right now, but we strongly recommend that everyone, whether you're in a school or in some other indoor setting, that right now you are putting on your mask, again, to protect yourself and protect others from COVID-19. So same guidelines as anywhere else. In terms of masking, we really want individuals to be protecting themselves. So a very strong recommendation. We would certainly support any schools or businesses who decided to require masks of the students or patrons for businesses, because we are anticipating we're going to be moving into that high COVID-19 community level. So great question, but again, no health order, no mandate from the Chicago Department of Public Health or the city of Chicago at this time, because our hospital capacity remains good, our healthcare system remains in a good place. But if we see signs that it's being overburdened, then we will consider doing stricter mitigation measures, for example, issuing a health order requiring masking.
We have a listing of locations that offers COVID testing.
Yeah, so if you go to our website, again, chicago.gov/COVID, there is a section for testing. And if you click on that, you'll see different resources to find testing locations. We continue to have a partnership with Rush and Esperanza for a community site. If you look, you will be able to search sites that are sponsored by, for example, Shield, Illinois. And we have some other sites listed on there in a locator. So chicago.gov/COVID, look in the testing section. Another great resource, and I did put this on this final slide, is covid.gov. This is a website sponsored by the federal government, and it very nicely, has all of the important sections, right? Masking, testing, vaccination, therapeutics. So check that out as well. And they also have some resources on where to find some of these things. We've gotten some questions about where to get free masks. If you go to covid.gov, there's a section on masks, and you can actually search for pharmacies that have those free N95s that they were handing out. So good resources there.
How long after COVID can you get a booster? Are the numbers underreported if people are testing at home and not reporting positive results?
Yeah, two very great questions. So that first question of how long you have to wait, really you just need to get over COVID. And then once you're done with that 10-day period after getting COVID, you can go ahead and get your booster. You don't need to wait. In terms of that second question about reporting the home tests, it's a good question. So yeah, right now home tests are not being reported, which is why we have moved away from focusing so much on positivity, because positivity is dependent on, it's the percentage of the tests that are reported that come out positive. We know there are home tests being done. At the same time, we also know there are a bunch of home tests being done that are negative as well. So all great questions. The important thing is we're really focusing on, again, those cases and the real sign of a burden, or that things are, that COVID is really impacting our community, are those hospital numbers, because that is a sign that you might have more severe illness going around your community. So really great questions. That, again, the home test, fantastic resource. Please use them. Please get your free home tests. A positive test on a home test is a positive. You don't need to require any confirmatory testing from your staff who are reporting positive tests on that home test. And a positive test on a home test is a positive test. So make sure to reach out to a healthcare provider to talk about getting a therapeutic. But all really, really great questions. And we continue to refine how we're looking at our data, and we're trying to keep all of you informed. So keep these questions coming. Really glad that you're thinking about it.
How does a business report cases?
Yeah, so there is an online form. And actually, if you give me a moment, I'm going to try to find the email address for our team so that you can reach out to them. But again, we've had a team dedicated just to workplaces because we know how important it is to support all of you. And I want to make sure that I give you the correct email address, but they would be able to give you guidance on where exactly to report. But there's an online form, and if you're not sure, you can always email our team. And so if you just give me one moment, I will search for that and I will read out the email address. So it is very simple: workplacecovid@cityofchicago.org. So workplacecovid@cityofchicago.org. You can email the team and they can give you guidance on next steps of where to report and whatnot. And if you have any questions along the way, again, related to COVID, we have a fantastic team ready to respond and answer your questions and support all of you.
So to clarify, high transmission rate is more about hospitalizations and numbers of beds rather than positive cases.
So this is a little bit of, I guess, syntax, but transmission, so we're talking about COVID-19 levels, just level of COVID-19, which includes transmission. So that would be the cases, and it includes hospital burden and indications of severe disease. So transmission would be those case rates. Indication of severe disease would be the new daily hospitalizations. And then hospital or healthcare burden is the percentage of hospital beds that are occupied by COVID-19 patients. So we're talking generally about the level of COVID in our communities. So not only transmission, meaning like how many cases, how many people are getting COVID, but also how many are getting severe disease, how many are, what is it like, what is the strain on our healthcare system to overall have a level of COVID-19 and indication. So the CDC's community levels are a tool for communities like the city of Chicago to know and anticipate, like, where are things going with regard to COVID? When do we need to start recommending more protections, more mitigation measures? So I hope that clarifies. If not, please ask a follow-up and I'll try to do a better job.
What happens if a business has more than 5 cases and does not report it to the health department?
If you go look at our health order, there is a penalty that is tied to not following a city of Chicago public health order. So we really want you to report. And the reason we want you to report is so that we can work with you to prevent further outbreaks, to make sure that the outbreak isn't growing. We don't want more cases to be happening. And so really, it is a health order. If you look at the health order, there are penalties if you don't report. But the more important thing, the reason why we want you to report is so that we can give you all the support necessary to keep your staff safe, to keep your employees safe. So please, please keep talking to us. And if you have any questions, like I said, regardless of whether you have multiple cases that you need to report to us or not, if you have any questions related to COVID, go ahead and reach out to us. That's why we're here. We want to work with you because we know you've been through a lot over the last couple of years, and you are just so important for the vitality of our city. So again, thanks for all you're doing, and please stay in touch with us. It really is so that we can help support you and keep you, your staff, and your patrons safe.
What's the process or steps? What does the process of steps look like once something is reported?
Yeah, so when you report cases over to us, we have a team of infection prevention specialists, epidemiologists, medical directors. Your report is reviewed, and then someone will reach out to you because we ask that you list a point of contact. They'll ask some additional questions, and then they'll give recommendations on what to do to prevent further cases related to the outbreak or to prevent outbreaks in the future. So it really is a collaborative process. But once you send in that report, again, our team over here reviews, and then someone will reach out to you for follow-up.
Going over the questions to make sure we got at least all of them. Is Chicago still requiring businesses to report when 3 or more people in one location test positive within 2 weeks?
So the requirement currently is 5 or more, because that is the definition of an outbreak in a business setting. So 5 or more. There are other settings, for example, daycares, healthcare facilities, where the outbreak definition is 2 or more, but for general businesses, 5 or more cases is considered an outbreak, and that's when you need to be reporting over to us, again, so that we can review, see what we can do to prevent further cases. And again, the other requirement for businesses is if you're having to pause or modify or change your business operations because you have so many COVID cases, you should be talking to us, because we want to support you and help you get your business back on track.
Looks like we have 2 more questions. Does it matter how many employees you have regarding reporting requirements?
I looked on Amazon. They got 4.
No, it doesn't matter how many employees. It's the same. It's just the epidemiological definition of an outbreak in a workplace setting. So regardless of the number of employees you have, it's that 5 or more cases.
It looks like, yeah, I'm going to say that's it for questions. Do you have any last or final thoughts, Jennifer, you want to offer our attendees?
No, again, I mean, really, it's just thank you for all you're doing. Thank you for your engagement. I can't believe it's been more than 2 years, but just really thank you for all that you're doing. Thank you for your very excellent questions. As a reminder, we are here to support you. And so please reach out to us with any questions you have. Our website is a good place to start, chicago.gov/COVID, and including if you go to, I was just double checking, if you go to the resources area, you'll be able to, or sorry, the updates area. If you go to updates, you can actually see all of our health orders. And I believe the one related to reporting, that's the one at the top currently. So it's duties of hospitals, other congregate facilities, and business establishments, if you just want to review what that health order says. But really, again, the point of reporting is so that we can work with you and support you so that your business can thrive and so that you can maintain a safe environment for everyone. But again, we're at a different place in the pandemic. We need to be cautious right now because our cases have been high. We're closely watching our hospitalizations, but we know what to do because we've been at this for 2 years now. So please, everyone, stay safe. Again, thank you for everything that you're doing and for your engagement today.
Thank you, Jennifer, for your presentation today. Thank you to all of our attendees. If you are a part of the BACP Entrepreneur Certificate Program, you can get credit for joining this webinar by sending an email to bacpoutreach@cityofchicago.org. Again, that's bacpoutreach@cityofchicago.org. Thank you so much. And to find out about our upcoming webinars, please visit chicago.gov/business education. Thanks again, Jennifer.
Thank you. Stay safe, everyone.